I'm going to introduce in a moment. This roundtable is sort of in the background of what's going on in Washington, which is a fight now with the budget, keeping the government open, and the fight over extending the federal subsidies for the Affordable Care Act. I'm not going to get into the politics with this roundtable today. We are going to focus on what the Affordable Care Act means to the American people, and especially to people here in Florida, because we're going to be significantly impacted if these subsidies run out. So I'm going to tell you who my guests are. I got Dr. Lawrence Weinstein, who is a cardiologist, and he'll tell you more about himself in a moment. We have Matthew Perkins, who is our local health insurance agent here. And most importantly, we have a consumer of the Affordable Care Act, Cara Farley, who is a mom. Let me just start off just with a little background of what's going on. We have about 24 million people in this country on the Affordable Care Act. What the Affordable Care Act allows people, depending on their income, to get a subsidy from the federal government in order to be able to help for them to afford insurance. But more importantly even is the conditions of the Affordable Care Act. You can get insurance even if you have a pre-existing condition. You can insure your child up to the age of 26. You get your checkups for free. Women get their birth control for free. And so there's a lot of good parts of this that are keeping Americans much, much healthier. Significantly for Florida, and this is something that I was surprised to learn, is that we have the most number of people in the country on the Affordable Care Act, over 4 million people. And that's because we did not expand Medicaid. So cutting off federal subsidies are going to impact us significantly, because about 90% of our enrollees here in Florida account on these subsidies. And Cara, you're going to explain what that means. And what we will see, if we're not able to get this extension, it will not only impact people's health, but have a huge economic impact in Florida and the country. And we're talking about loss of here in our state almost 50,000 jobs, and a loss of over $5 billion in economic activity, just because what will happen in the healthcare system. So, Senator, I'm not going to ramble on. I'm going to have you introduce yourself as I ask you a question. So, I'm going to start with our doctor. Okay, Dr. Weinstein, just give everyone quickly your background, and then what I want you to just tell us is what you see as the importance of keeping people healthy, and how the Affordable Care Act has helped that to happen.
My name is Dr. Lawrence Weinstein. I'm a practicing cardiologist here in Boynton Beach. I was trained at a 6-year medical program geared to prepare doctors to work in medically underserved areas for many years. I ran the cardiology clinic at New York Hospital Queens, taking care of the underinsured. And I recently, 2015, got my master's in healthcare administration at Florida Atlantic University to be part of the solution to give the best quality care at the least possible cost to the population. My fears with what's going on right now, if the subsidies expire, is that this will be a slow-moving tsunami affecting Florida. And while the effects of this change won't be felt immediately, when it comes, it'll be deep, widespread, and long-lasting. We have about 4.5 million Floridians on the Affordable Care Act. It's about 1 in 5 residents. Many of them, if the subsidies expire, will be priced out of their ability to get care. And this will have significant effects on everyone, not just those that are being insured. Because what happens is many will be priced out of being able to afford care. And when they get to the hospital, they won't be able to afford going to the emergency room, which will become their primary care place of focus. Once that happens, they'll be sicker. The cost of care will be then transmitted to everybody else who has insurance, which will make the cost of care for everyone go up. In rural areas, hospitals may close because they won't be able to afford taking care of patients. They won't have insurance, and that'll just make things more difficult for everyone. Patients will become sicker because they won't be able to get primary care because they lack insurance, and that will also increase costs for everybody. So this is a really terrible thing that will happen and totally predictable.
Okay. Well, thank you for sharing that alarming news. I'm going to go to our insurance agent here and give us an idea. What if the affordable? Oops, let me just get you over here. You can just leave it on. Okay. If the program ends at the end of the year, what's the analysis of what will happen to insurance premiums?
If they do not go ahead and continue on those enhanced premium tax credits, just looking at the situation and the system, there will be minimum probably 5 million people across the country that will lose their insurance because they will get no subsidies whatsoever. The American Rescue Plan enhanced those tax credits where I've personally enrolled thousands of members in health plans since that American Rescue Plan did give us more tax credits. We'll also see people who are, at the minimum income levels, that minimum poverty level is 100% of the federal poverty level. And those people will right now are paying $0 for a silver health plan with affordable copays, where they've got zero copay for a primary doctor, like a $10 copay for a specialist, something they can actually afford. And those plans are projected. We don't have the numbers yet because it's not November 1st, but those plans are projected to go, anywhere from like $80 to over $100 per person come January 1st.
So these are people who are making what, $15,000 a year.
Correct.
So if they have a family of four, you're tacking on another $400 a month for them. And what about just a middle income person? Because it sounds to me what's going to happen is the premiums. I mean, the predictions are that they could double, they could triple.
Correct.
Around the country. So a middle income person, what does that mean?
So that middle income person who's say making $30,000-$40,000 a year, they're going to see premiums probably go from about $100 a month to $400 or $500 a month. So these are astronomical numbers. The predictions are biggest since 2018, biggest rate increases. So if Congress doesn't come together and keep these enhanced tax credits, it's going to be devastating for the whole system. I mean, Floridians alone, like you said, we have over 4 million people insured. And I know that we will, a lot of people will go without insurance. And as the doctor explained, it's a ripple effect. It affects everything. My job is to find coverage that, that gives people what they need, that it's affordable. And without these tax credits, it's something that any insurance agent is not able to do because they're just unaffordable. And it will trickle down to group health insurance.
Yeah, explain that because, sometimes people say, well, it's not going to be my problem. Right?
Correct.
How will, when so many people are taken off Affordable Care Act and premiums start going up, and we see a ripple effect on the healthcare systems where doctors and hospitals are not getting paid, have to raise their prices, what does that mean?
Well, that is because the pool is going to change. As the doctor had said, we're going to see that healthy people are the first people that are not going to pay these prices for insurance. So what that does is it makes the cost of care immediately go up for the people who need the insurance. So the goal is we have to have a big enough pool of healthy people to keep costs at a level that is affordable. I mean, because it's every business, it starts at the consumer and they can't afford it. And then the doctor can't afford it, and it keeps going. So, this will, in my opinion, it's a very detrimental thing that we come together and make sure these enhanced tax credits are still here for Floridians and for all Americans, because that's what this system is for.
Yeah, I want to just emphasize really it's really a principle of insurance, which is the more people who are buying insurance, the lower your premium. That was one of the beauties of the Affordable Care Act, which is start lowering everybody's premium. In fact, in the last few years, we had the most number of people insured in this country in the history of this country, right?
Yes.
So what we're going to see, unfortunately, will be just a dramatic change. And so you would expect everybody's premium will go up.
Yeah, I mean, on an annual basis, unfortunately, those premiums do rise anyway. So there has been cost increase, but with the enhanced tax credits, it's been able to offset that a little bit for, a lot of Americans and keep it more affordable. So it's definitely going to tip the balance.
So if you're on the Affordable Care Act now, and you're middle income, a little higher, $50,000-$60,000 a year, if your premium is $500 a month, it could probably go to $1,000 a month. And if you have a family of four, that's $4,000 a month. You think about that. That is a huge impact. And I know someone who's going to talk about that. And Kara, tell us about yourself.
Sure. So I'm really excited.
Wait a minute, but first I'm going to give you the mic.
I'm very excited to have an opportunity to share a little bit of my story. This is my first time doing this, so I'm a little nervous.
So don't be nervous. It's just us.
I'm going to share just a little history of what my life was like before I had insurance and since. In 2008, I was 23 years old. I was diagnosed with ovarian cancer. I was diagnosed in an emergency room because I didn't have health insurance, so I went in with my symptoms, had surgery the same day. Because I didn't have health insurance, I had to go across the state to a teaching hospital that offered financial aid, and even with that, I spent years with poor credit paying medical bills as best that I could because it was astronomical. In 2011, I tried to get insurance for me and my daughter and was denied due to a pre-existing condition. My husband is he's a type 1 diabetic. So as an uninsured diabetic, we've tried to budget for the cheapest insulin possible. He used finger prick monitoring to try and gauge his blood glucose levels. We moved to Palm Beach County in 2021, and we qualified for a marketplace plan with a subsidy. And since then, my husband is on an insulin pump. He's able to have a continuous glucose monitor that now tells him before his sugar is getting low so he can treat. He hasn't had to go to the emergency room with a hypoglycemic episode in over 4 years. I was diagnosed with a malignant melanoma in 2024 and was able to just go to the dermatologist, get treatment, see the oncologist, my surgery. I just paid my copays and my deductible. And without having access to insurance, I probably would have never gotten the mole checked. I'm continuing treatment now to make sure that it hasn't spread to my lymph nodes. And I've also been able to access the screenings that I need to make sure that my ovarian cancer has not recurred in my remaining ovary. We have 4 children at home. My oldest is 14 and my youngest is 6. And she has a neurodevelopmental disability. So she takes a lot of our time and efforts just to meet her needs and follow up on her medical care, and being able to know that my husband and I have access to treatment, that we're going to be healthy and can be the best parents that we can be to meet her needs has been just life-changing for us.
Thank you very much. And here's the thing. Kara is one of millions of stories. She's one of millions of stories, especially here in Florida, because we have the most enrollees in the Affordable Care Act.